Grazie, grazie mille. Grazie. La porta la chiudiamo? Okay. Good morning, everyone. Welcome to the new Value Open Lecture. This is a central issue of the ValEUs Project, the gap between the values stated in the EU treaties and their implementation in international relations. And the European Union is facing especially contestation from the former colonized world, who has very real reasons to be skeptical in the application of these values in practice. And this issue of the relationship between Europe and Africa is an emblematic ground for studying this problem, given also the intertwining of European integration and the colonial legacy of many nation states. So today's lecture is delivered by Valeria Fargion, who has been addressing this issue through research for years. And the title of the lecture is The Double Standard in EU-Africa Relations. Valeria Fargion is professor of political science, and she is holder in 2004 of the Jean Monnet Chair, Politics of European Integration, as part of the master's degree in international relations and European studies. And over the last decade, our research interests have gradually shifted from the policies of advanced countries to the role of the European Union in the international area, and with a particular focus on global health issues and the analysis of development cooperation in Africa. She has written many interesting books and articles, of course, but I want to mention one in particular, a book that is revisiting EU-Africa relations in a changing world. She is the editor, together with another author, Mamadou Gazibo. And and of course, I recommend you this reading. So thank you very much, Valeria Fargion, for accepting to join us in this lecture. The floor is yours.
Thank you very much for inviting me. And actually, I didn't expect to see so many young people, so I'm very happy. I coordinated the European Studies master track for many years, so I'm used to being with lots of young people, but I retired recently, so it's wonderful to see so many young people again. Let me say, first of all, a few words on the title. Double standards in EU-Africa relations. Double standards. Actually, what I will try to show, and I will use a lot of evidence, is that unfortunately we can notice a gap between discourse and policy practice when it comes to looking at EU-Africa relations. So, as I said, I'll be providing lots of evidence, but to be honest, the title is correct up to a certain point, because if we look at very recent developments, the gap between discourse and policy practice, the gap is closing. But I'm afraid that's not good news, but I'll leave it to the last part of my presentation to explain why it is that now this gap between what the EU says and what it actually does on the ground is sort of, the difference is not as big as it used to be. But why is it that they should be double standards? Why is it that this should be the case? My perspective is a perspective of a political scientist with a public policy perspective. You know, public policy has always been my interest. So what I'm focusing on in my, let's say, even my theoretical framework is that how is it that we can explain this gap between what the EU says in its documents and what it does on the ground? My position is that in order to understand this gap, we need to put into the picture, on the one hand, power dynamics inside the Commission. Why power dynamics inside the Commission? Because the different DGs do not have the same power. So we're witnessing power dynamics inside the Commission, bureaucratic politics. And it is different when we're talking about DG Trade or DG Environment or DG Grow, or whether we're looking at DG DevCo. That was the name of the DG that now is DG INPA, DG International Partnerships. Obviously, the strength of the DGs such as DG Grow, DG Energy, the strength is much bigger compared to the strength of what was originally DG DevCo and now DG INPA, or even other DGs like DG Employment that deal with social policy issues. So on the one hand, we need to understand that there's a struggle going on inside the Commission. The Commission is a multi-actor organization, so with different interests, with different positions, with different aims. Not only, but even if we look at the stakeholders, we can see that the stakeholders behind and pushing and pressuring towards, let's say, DG Energy are much stronger compared to the stakeholders that have a possibility, that are interested in the DGs that deal with social issues. So there's even a difference in terms of the pressure that is exerted by the stakeholders. But that's only one part of the picture. We also need to take into consideration that there's even power dynamics that go on between member states and EU institutions. So we also need to look at this other part of the coin. It's not just what goes on inside EU institutions, but there's even what are the dynamics between member states and EU institutions. And in this case, not necessarily do we see convergence. We can see that different member states have different priorities, and depending again, once more, on their political strength, you might have the capacity of certain member states to exert greater pressure on EU institutions compared to others. So it's a complex game that brings out what? That produces outcomes that can be some, and often are, unfortunately, inconsistent with EU goals and values, okay? But, as I said, this holds true up until very recently, but I will leave this to the end. Before I go into the bulk of my presentation and tell you how I intend to organize it, I would like just to remind us that why should we pay attention to EU-Africa relations? Right now, political attention is mainly focused on what's going on in Ukraine, what's going on in the Middle East. Why is it that we should pay attention to Africa? Well, so before starting, I thought it would be useful to just remind us all a few data on the demography and what will happen over the next years. What do we see here? Basically, the message that comes out of this is that Africa is the continent that will grow the most in demographic terms. Population is growing. Consider that Africa nowadays has about 1,400,000 people living, okay, in the continent. But it will be 1,800,000, according to demographic projections, by 2030, and it might turn and be over 2 billion, maybe even 2.5 in 2050, which means 25% of global population. I have to say that I have a bad cough, so I do hope that I will be able, if I stop or I drink, I've got medicines around me. I think I got this on the airplane coming back from the States. So my point here is, look at the evolution, look at this, what is Europe on a global scale? As you see, we represented about 10% of global population in 1960, but we're going to be less than 5% in the future when it gets to the 2100. So the point is, we cannot we are not paying enough attention to what is going on in Africa and our relations with the continent. The continent is right in front of us. The population is young and growing. Whereas in Europe, the population is aging, as we all know. The population is aging. Instead, we've got in front a continent with young people. Median age, if you look at, for instance, this is an indicator which is very important. Median age in Africa is 21. median means 50% of the population is under 21, which is crazy. Look at Europe instead, it's 44, which means that 50% of the population is over 44. It's this is the old continent, but under all respects. Old, yes, but also because of the kind of population and the fact that fertility rates are extremely low. I don't want to present other data, but there are so many things that suggest that Africa is a continent on which we should concentrate our attention. So let me go on to say, how is it that I mean, the different points. As you see, I would like to touch 6 different points. I hope I will make it. First is the EU development cooperation with Africa since the turn of the century, an overview. So I'm looking at data, evidence that points to this, to these double standards. This is what I'm trying to do. Number 2, I will look at EU migratory policy, and in particular, focusing on more recent events, from the Lisbon Treaty to the Valletta Summit and the European Trust Fund for Africa. So development cooperation, migratory policies. Then I will go on to the response to the COVID-19 pandemic. What did the EU do? Can we see, even in this case, double standards in what the EU was saying and what it was actually doing? Then the multi-annual financial framework, which is the current framework, the current financial framework 21-27, and also the 2022 EU Africa Union Summit, which is a very important moment in terms of the definition of the relationship between the 2 continents. Do we see even in this case, double standards or not? Number 5, the global gateway. I don't know how many of you know about it. I will try to say a few words on it. First is that that was the EU's reaction to China's, probably you have heard, the Belt and Road Initiative. This was, the global gateway is the reaction of the EU to China's strategy, so that goes under the label Belt and Road Initiative. Finally, some hints on how to go ahead. My appraisal is very critical of what we've been doing in the EU, and the point is, can we do something better? What is it that we should be doing? Those will be my final comments. Why is it that, before I start, why is it that we are not in such a good position and we should consider changing our strategies? Well, basically because Europe has a colonial past, and in Africa, I mean, it's difficult. In Africa, this brings up bad memories, not good memories about Europe. So that's the starting point. Are we seen as, you know, the ones that are there to help out, the ones that are there to be partners, yes or no? I can give you just and are we important? Are we players or are we simply payers, as we have been for a long time? When it comes to players, I always come up with this little anecdote. I had an interview with the Minister for Energy in Tanzania. I always say this because it shocked me. And I asked him, what is the perception of the EU in your country? And after some kind words, he said, insignificant. So let's consider that, you know, we are 1, bad memories, 2, insignificant. So, and I will say more even about recent developments in Africa, recent political developments that make it even more important for us to think differently when it comes to our relationship with the continent, because the situation is not easy at all. So let's start. Where do we start? As I said, I want to start with development cooperation with Africa. I can't go back to the 1950s and 60s, otherwise I would just spend all of the time on that. I want to take a look at the last 20 years, okay? Since the turn of the century. What can I use as a starting point? I'd like to use this sentence from a speech by Romano Prodi, who was here yesterday afternoon, and I hope some of you managed to listen. It was in Italian, it wasn't in English, but I hope that some of you managed to attend his lecture, which was extremely interesting and very insightful. What did he say in his speech on Europe and global governments in Brussels, 31st March, the year 2000? As you can read here, the very forces which are uniting the planet threaten to deepen the divide between rich and poor countries, between the haves and have-nots in our societies. In many people's minds, the term globalization has come to mean economic colonialism, the new imperialism of the rich nations. This must not be the case. We need globalization that promotes social equity and works to everyone's advantage, including the poorest nations on earth. So, what is it that Prodi is telling us? And why is it that he is saying this at this moment in time? Well, the point is, you probably have never heard about this, but there was, the No Global movement erupted on the international scene in Seattle. And the idea was globalization is bad. It's not good as we've been told so far. Now, so what is it that Prodi is saying? Well, let's take a more cautious approach. Okay, it's not been wonderful what we've done so far in terms of globalizing the economy, but it isn't even all bad. So his position was, we need, you see at the end, we need globalization that promotes social equity and works to everyone's advantage, including the poorest nations on earth. So how is it that he translated this discourse into practice? Well, actually, if you go and look at what happened in those years at the Commission level, you will see that he introduced a wide range of organizational reforms inside the Commission, precisely to make sure that development cooperation would work in a better way compared to what it had done up until then. And in what way was it supposed to work? And here, what I'm putting, again, I don't know how many of you have ever heard about this, because this dates back to the year 2000, the UN summit of September 2000, and the launch, perhaps you have heard the MDGs. Now we talk about the SDGs, not the MDGs. But at the time, it was the MDG program, which offered, as I put it here, a window of opportunity for the European Union. Okay, now the point is, what is it that those MDGs were focusing on? Well, you can see it very clearly. Let's start number one, eradicate extreme poverty and hunger. So definitely this is a social aim. It's improving people's lives, and especially looking at the poorest, as Prodi was saying, the poorest on earth. Achieve universal primary education. Promote gender equality and empower women. These two, number 2 and number 3, have to do with education. So a focus on education as a crucial element for improving people's lives, what we would go under the general label of human development. Then we have number 4, number 5, and number 6, which all have to do with healthcare. Number 4, reduce child mortality. Why reduce child mortality? Because here in Europe, we're not used to considering this as a major problem. But if you go to Africa, this is a major problem. I'm talking of Africa because that's where the figures are the worst, are really terrible. And they're still terrible 25 years later, although they're a little better than they were. Number 5, improve maternal health, also because so many women die during childbirth, which again is something unheard in Europe, or at least extremely rare. But it's unfortunately something that happened a lot, and it continues to happen in Africa. Number 6, combat HIV/AIDS, malaria, and other diseases such as tuberculosis. So you see, the next 3 goals have to do with healthcare. And then number 7, environmental sustainability, a global partnership for development. This is, let's say, the theoretical framework that the European Union fully endorsed, okay? So the point is that they actually translate this into practice, but before we go into this, this was the year 2000, and I need to say that unfortunately, the international context was not exactly favorable for pursuing those goals at that point in time. Why? Again, it's way back for you. Most of you we're not here, we're not born. But what happened is that the war on terrorism Why the war on terrorism? Because 9/11. Terrorism, the Twin Towers. So let's say the focus was not so much during those years on social issues, but it was on security. The war on terrorism dominated the international scene, as you can, I put it here. Within this radically changed context, the implementation of the MDG program suffered a major slowdown. But quite paradoxically, and this is the point that is of interest for what we're talking about today here, The Iraqi war accelerated the emergence of a fully fledged European strategy on how to address globalization problems. So it's Prodi that tells us how to address globalization in 2000, but actually we have a fully fledged strategy only, as I point out here, between 2005 and 2007. I label this as the grand design of EU cooperation with Africa. What is the document that I'm referring to in particular? I'm referring to the European Consensus on Development. Excuse me, what about this chair here?
Oh, thank you.
I keep... Okay. The European Consensus on Development. What is this document? This is a document jointly agreed by the European Commission, the Council, and the European Parliament, which means the three main institutions endorsed the document. This is what I want to emphasize and underline. So this was the official strategy position. And what was it about? The consensus puts forward a fully fledged development strategy tightly anchored to the Millennium Development Goals, what I said previously, which means a social perspective, a perspective emphasizing human development, talking about education, health. This is basically what we find in this document, okay? But as you see, at least according to the official discourse, here comes the bad news. I have, as Professor Leonardi was saying, I've worked for many years on this topic, analyzing what? Analyzing, for instance, all of what are these CSPs, NEIP, you know, these acronyms, the EU loves all of these acronyms. CSP means Country Strategy Paper, and NIP means National Indicative Program. What are they? Basically, they are documents in which the European Union, with each partner country, defines the priorities of its intervention in development cooperation, okay? So we have a country strategy paper for Burkina Faso, for whatever country you have in mind, Senegal, Niger, Gabon. And if you go and look at those country strategy papers, which simply changed their names in the following period and became national indicative programs, if you go and look into those programs, what do you see? You see that usually you have 2 or 3 priority areas that are identified in these documents, okay? So what I have done, and this table comes from this book that Professor Leonardi was mentioning, Revisiting EU-Africa Relations in a Changing World. What I've done is I reclassified in order to have a grid, in order to better understand what were the priorities that were endorsed in these documents, okay? I still need to add another piece of information. What is this 10th EDF? That's the funding instrument, European Development Fund, okay? Funding instrument for the period 2008-2013, okay? And then 11th EDF for the period 2014 to 2020, because you know that the EU works on a multi-annual budget, and the budget is a 7-year budget. So we look at what was decided for the 10th EDF and then what was decided for the 11th. And what do we see? Yes, I want to check that you can see what I'm pointing. In 24 cases, you know, this refers to 48 sub-Saharan countries, okay? In 24 cases, we see that budget support is considered a priority, okay? What is budget support? Budget support is giving money to the government, and then the government will spend it. I have been extremely critical on this procedure. Why? From a European point of view, it is not very strategic. What do I mean? I'm giving money, let's say, I'm giving money to Niger. And then Niger decides where it's going to put the money. Now, the people that live in Niger, how do they know that their money is coming from Europe? So it's simply a stupid, I'm being extremely clear on this. It's a way, why did they do this? Because it's very simple. To write out a check and hand it over to the government, it doesn't take a long time to do that, okay? So budget support, which is being strongly supported by the commissioners that were in power at the time, that were in office at the time. So in 24 cases, I find budget support. Then good governance, support of civil society. What goes under that is not clear. Transport infrastructure in 23 cases. Trade, regional integration, job creation, trade, organizing. You see, the EU has this single market. So the idea is let's try and promote a single market even in Africa. So in 10 cases, it's trade, regional integration. And then it goes down. Only in 12 cases, agriculture, energy in 3. Energy is very big at the moment. 5, peace building, 13. But when it comes, these areas, when we get here, water, sanitation, human development, education, and health, look, only in 4 country strategy papers do I find health, and only in only in 5 do I find education. Not going well. So you see here, this is evidence of a gap between discourse and policy practice. The 11th EDF goes a bit better, with 12 cases for education and 12 for health, but still, it is not a priority. What goes under good governance is basically renaming budget support. So I'm afraid I will have to take my drops. I told you I was in trouble. I'm sorry. Okay. Now, so the first message is that unfortunately, with development cooperation between the year 2000 and the year 2020, what was written in the documents does not correspond to what was actually funded in the programs on the ground. So, from looking at this first area, we have the impression that talking about double standards is meaningful, okay? Double standards. I say something and I do something else. Now, this, to me, this is very important. As you saw, as many as 3 MDGs are related to health. And so what am I looking at here? I'm looking at what is ODA, is Official Development Assistance. Health Official Development Assistance by donor. Why am I looking at between 2000 and 2018? So I'm looking at the entire period before the outbreak of COVID-19, okay? What happened before? Again, this is a table that you can find in the book that I mentioned. And what is it that I'm doing here? This is a difficult table, a lot of figures, but I'll walk you through it. I'm looking at what the changes between the year 2000 and the year 2018, okay? First point, because this is the point I want to really make. EU, Commission, and member states, putting them together, summing the money spent by the EU and member states, okay? And let's look, it is easier, just let's look at a percentage. Out of 100, that is to say, out of the total amount of money that was spent for health at a global level, so we're talking about global health, we see that at the time, the Commission and member states accounted for almost 15% of 100, you see? 15%. Now let's go straight to 2018, 8%. Is that an increase? No, that's definitely a drop, okay? On the other hand, who's going up? United States, from 13% to 17%. China, at the time, up until 2018, still wasn't a big spender. But I'll tell you more about when it comes to the COVID period. Who is it that gained ground? It is especially NGOs. Look at NGOs were 14%, they're now 28%. So what is the message that comes out of this difficult, full of figures, this table? It's that the European Union and the member states have progressively downsized their intervention when it comes to issues of global health. They have downsized, they have reduced the amount of money, and unfortunately, what's been going on is not governments, it's NGOs. Okay, NGOs are wonderful, but can they really do what governments could be able to do? This question mark. But on the other point, please consider, probably, I don't know if you know, but there was even an Ebola outbreak. You know, with Ebola, a lot of people died in 2015. So in the middle of this period, it's not that we didn't have big problems. We had huge problems. And why are these problems relevant even for us? It's not just an issue about Africa or other countries, because with the communications that we have nowadays, airplanes, you jump on an airplane in one part of the world and you end up on the opposite side and you're taking with you viruses, including what I've got right now. So communications are something that are spreading viruses across the world, so no one is safe unless everyone is safe. Health is important for the entire planet. It's not just an issue that refers to where the problems arise. And here you have even more detailed data. Health odor. European, since in the previous table I combined the Commission and member states. Here, instead, what I'm doing is I'm disaggregating. And what you see, okay, at the time, you've even got the United Kingdom in the picture. It's this green line, okay? You see that more or less, the 200 million euro, actually in the case of the UK, it went up to 400 million each year, okay, in money spent for supporting what? Healthcare in Africa. The other two lines here are the blue one. The blue one is the European Commission, and you see that this is the European Commission. It spent less than what the UK was spending, and here you've even, the two lines actually more or less, sorry, I don't remember Germany, France, this is France down here, and this is the total for all the member states. So what is this big figure telling you? It is telling you that member states spent a lot more than the Commission, okay? Which means that member states were more important players when it comes to health in Africa than the Commission itself. Actually, I put it down, the total amount, I wrote it somewhere, is 3 times as much. Over the whole period, member states spent 3 times as much as the Commission in terms of the support they gave to healthcare systems in Africa, okay? So the picture here is a picture where it is hard to say that the European Union was actually, let's say, translating in practice its commitments with respect to the Millennium Development Goals. This is the first message. So there is definitely, to go to the title, there are double standards when it comes to development cooperation. Okay, what about, and actually I wanted to mention another document that fully endorsed these Millennium Development Goals, and this is striking to me. I only found it the other day by chance. I'd completely forgotten. In the joint Africa-EU strategy, which was approved in May 2011, okay, the 4 main objectives of this long-term strategic partnership are, and one reads on point B, to ensure that all the Millennium Development Goals are met in all African countries by the year 2015. So this is something that was written in 2011. So again, in 2011, the EU was still confirming that it was supporting Millennium Development Goals. But as I've showed, I mean, the data simply show that it's not the case. It's not at all the case. Now we move to a different topic and see if it gets better, but it doesn't. The EU migratory policy. From the Lisbon Treaty to the Valletta Summit and the European Trust Fund for Africa. I will explain what these are. Okay, probably you know, this you probably know from other courses, EU law. In the Treaty of Lisbon, what do we see? The Treaty of Lisbon says, I just want to remind us just what is written in the treaties. The Treaty of Lisbon sets the objective to establish a common European asylum system. Article 78 in particular, what does it say? The Union sets the objective to develop a common policy on asylum, subsidiary protection, and temporary protection, with a view to offering appropriate status to any third country national requiring international protection and ensuring compliance with the principle of, this is an important principle, of non-refoulement, which means you can't send them back to where they came from if that is a dangerous country especially. Article 80 also talks about, I don't need to go into this, solidarity and fair sharing of responsibility. Now, what happened on the ground? Actually, during the first years, there was a legislation which was quite positive with respect to asylum seekers. But let's remember that the EU has only a shared competence when it comes to migratory policies. You have member states that are responsible for looking for the borders, for defending the borders and for guaranteeing access into the borders. And you again have member states that are responsible for integrating people in their societies. So the EU has only a responsibility for what? For the procedures that have to be followed when someone comes, puts a foot on the European territory. What are the procedures to make sure that the person is treated with equity, in a fair manner, in a correct way, with dignity? So this is the part of the EU, which makes it difficult, obviously, because of this mix of responsibilities between member states and the EU. But having said that, because we could have a class only on migratory policy, this is not the point. My point here is what happened in 2015? What the so-called, I'd say, quote unquote, migratory crisis, which had to do primarily with what happened in Syria, with hundreds of thousands of people running away from Syria and from the terrible situation that was there. And in 2015, the EU reaction was, with respect to what was going on, the Valletta summit. So now we need to look at what was decided at this summit with migration policy, and next step, what happened with respect to policy implementation. The Valletta summit, as you can read here on migration, brought together European and African heads of state and government in an effort to strengthen cooperation and address ongoing challenges. This is very neutral. Leaders participating in the summit adopted a political declaration and an action plan, and here is the interesting part, officially designed to, number one, address the root causes of irregular migration and forced displacement. Number two, but let me stop first. What does it mean, address the root causes? This expression, address the root causes, basically is understanding what are the reasons that force people to move, to leave their own village or wherever they're living. What are the causes? Why is it that people are running away from where they used to living? So if you have to address the root causes, it means you have to understand what are the causes. And basically, in Africa, there are two basic causes. One is climate change. I don't know to what extent you are aware of what is happening in Africa in terms of climate change. We might be, let's say, worried about what's going on with climate change in our own countries. All of a sudden we get a lot of rain, or we have fires. Yeah, nothing to do with what is actually happening in Africa. In Africa, Africa is the continent that is suffering the most from climate change. And it's suffering in a double way: desertification, and at the same time in other parts, floods, which means that the fields that are crucial, for food, for producing the food you need to eat, get flooded. You can't work on them. You can't produce anything in those countries. And at the same time, desertification. You don't grow anything. So climate change, you can find in other presentations, I usually use the maps to show you that migration is tightly connected to the amount of rain that you have in the different parts of the continent. But this is one part of the story. The other is conflicts. People run away because of conflicts that are widespread, unfortunately, in a number of countries. I will come to that later, but I was in Sudan 3 weeks before the outbreak of the war, so I have a precise feeling of what was going on. So conflict and climate change. These are the two main reasons. So if you want to address the root causes, you have to do something which had with climate mitigation, and perhaps, if possible, something with conflict prevention or in that area. Other goals: enhance cooperation on legal migration and mobility, reinforce the protection of migrants and asylum seekers, prevent and fight irregular migration, migrant smuggling and trafficking. You know, this is what we usually hear in the political discourse in Europe. Work more closely to improve cooperation on return, and this again is another topic that we hear a lot of in the political discourse in all of the national systems in Europe. But number one was address the root causes, which you could see is more connected to Millennium Development Goals, human development, climate change, ecological transition. Okay, what is it in practice was done in order to translate into practice the commitments endorsed in the summit? What is this EUTF, European Emergency Trust Fund for Africa? And what you see here is that this fund, which was specifically established to address this migration issue in the terms defined above, was actually divided in three so-called envelopes or windows. So one part of the money, as you see, 42% for Sahel and Lake Chad, and you see in green, this is the 42% of what amount? Originally it was 1.8 billion. I'll tell you more in a minute. Then for North Africa, 18%. This is the two countries, Libya, Egypt. And Horn of Africa, 36%. Okay? So the trust fund, the emergency trust fund, was supposed to work only in these 3 areas, not in all of Africa, but it's most of the countries, it's 28 countries. But the interesting part comes now. Through the European Trust Fund, the EU has supported 27 countries. Where does this come from? This is the Court of Auditors. I'm using information from a document by the Court of Auditors, which was issued in October 2024. So it's a very recent document. And I have simply copied from that document, with 933 contracts under 248 programs. And here we start seeing something interesting. Though the initial endowment, as I said, was 1.8 billion, to date, the trust fund has received more than 5 billion, so an enormous increase in the amount, very substantial, more than doubling, substantial increase in the amount of money, okay? But look, the greatest part, 4.4 billion, or 88% of the total, has consisted of transfers from where? From the European Development Fund. Actually, as you see here, it's 67% comes from the European Development Fund. You remember I said the European Development Fund is the financial instrument that serves to support development cooperation. Now we are moving the money out of the development fund and we are putting it into this emergency trust fund, which has to do with migration. So the money is going out of development cooperation into this fund which has to deal with migration. And basically it's the money is all 67%, which was like something like 2.8 billion, coming from taken away from the European Development Fund, okay? So this is the first thing. Actually, contributions by members, there was a contribution also by member states, but we're talking about 623 million compared to the 4.5 billion put by the European Union. And now becomes even more interesting because this again comes from the Court of Auditors. In order to run this trust fund, a special body was established, a strategic board was set up. And what we see here, and we'll go through it in a minute, is the priorities for the 3 areas identified by the trust fund by the strategic board in 2018. What are the priorities? For Sahel and Lake Chad and Horn of Africa, so 2 of the windows, what is number 1? Can you read? Return and reintegration, okay? What is number 1 for North Africa? Integrated border management. So this is not exactly what we read in the previous strategic document. Address the root causes of irregular migration and forced displacement, okay? Is it clear what I'm saying? Now, actually, the curious thing is that the Court of Auditors takes, I'm reading the document, so I still haven't finished. It's interesting to go ahead. But basically, the Court of Auditors is complaining because, according to the Court of Auditors, the programs which have been put in place do not follow the priorities that are set by the board, which means that the Court of Auditors is saying we should be even stricter with respect to return and reintegration, border management, etc. But I also want to say that the results of this analysis by the Court of Auditors are mixed and not entirely reliable. Let me read this from the Court of Auditors document. What did they say? The EU delegations in the countries we visited made every effort to comply with our requests. However, we were unable to visit all the beneficiaries and projects we selected for our sample, either because the project implementers, the EU delegations, or the beneficiary could not reach the sampled beneficiaries, did not grant us the authorization to visit the premises, or because of time and security constraints. 5 project implementers did not provide all the information we requested. Missing elements included invoices, attendance lists, beneficiary names. This is the point. These problems impacted half of the project in the sample. So what are these results if half of the sample they were unable to actually check out? As a result, we were able to check neither the accuracy nor the sustainability of the reported outputs for parts of our sample, half of the sample. So my point is that it would be very interesting, in fact, to have some students work on a dissertation to find out what has been done exactly with all of that money. Because it is, as you say, not even the Court of Auditors is able to tell us exactly what happened with the money. So, but in any case, my point is that it's clearly a gap between documents and what is actually going on. In fact, if you look at the position by a number of NGOs, what they're actually complaining about is basically that what the European Union is doing is externalizing its borders, externalizing to Niger, externalizing to Northern Africa in order to block arrivals. Let me add something here that is not, I have not put data on this presentation, but please be aware of the fact that the number of people that are crossing the Mediterranean has nothing to do with the numbers of internally displaced people in Africa. You can go out and check it for yourself. When we're talking about refugees and internally displaced, you know the difference. Let me, just in case. Internally displaced means you're moving, you're leaving your village, but you're staying within the borders of your own country. Refugees, asylum seekers are crossing borders, okay? If you look at those figures for Africa, we're talking about millions, okay? Even without counting Sudan, where we're talking about 10 million, but even in other countries, the Democratic Republic of Congo, 6 million. In Uganda, almost 2 million. So millions, okay? Look at the figures, for instance, for the people that crossed the Mediterranean and got into Italy, in particular Sicily, landing in Sicily. Look at official figures. For 2023, according to the data provided by the Ministry of Internal Affairs, the figure is 123,000. Now, you do realize that if we're talking of 123,000, we're talking of 1,000, we're not talking of million. So there's an issue here about numbers. Okay. So we have so far noticed that I think that the title of double standards is correct if we're looking at these two areas. I still have so much to go. I don't know if my voice allows. What about the external response to the COVID-19 pandemic? Okay? Here, high commitments. With the outbreak of the COVID pandemic, we have, first of all, a joint communication by the Commission and the High Representative in April 2020 on a Team Europe approach, which means let's work together, Commission and Member States, to try and solve this terrible problem. Not only, but joint priorities even with the European Investment Bank, the European Bank for Reconstruction and Development. This is the Team Europe approach. Let's all work together, but to do what? Put the money together, support for global preparedness. What does this mean? Make sure that everyone is prepared in case there is a new outbreak. Promotion of global coordination and multilateralism. And in particular for Africa and in general, what is the main promise? The EU assumed a leading role by organizing a global pledging, what does it mean? Getting the money. Pledging conference on 4 May 2020. In von der Leyen's words, and this is what I want you to focus on, we need to bring the world, its leaders and people together against coronavirus. We need to develop a vaccine, produce it and deploy it. Please deploy it to every, this is the point, deploy it to every corner of the world. And so we need to deploy it, but we also need to make it available at affordable prices. These are the two commitments of Ursula von der Leyen. And unfortunately here, what I say is failed expectations. Why failed expectations? Because one of the issues had to do with what? You know that vaccines are produced by big pharma, and there are patents that these have that protect, you know, the production of the vaccine. So what was Cyril Ramaphosa asking for? Governments, by the way, there's a summit today with him, between Ursula von der Leyen and Cyril Ramaphosa in South.
They all know who Cyril Ramaphosa is?
President of South Africa. So this guy here today is meeting with Ursula von der Leyen. Cyril Ramaphosa. Governments that at the time he was president of the African Union. Governments that are serious about vaccine access for all need to approve the TRIPS waiver. What is this TRIPS waiver? It means let's not protect, just for a short time, let's not protect the big pharma. Let's allow even other producers to produce the vaccines, otherwise we'll not get out of it. In India, there's a very strong capacity to produce medicines and vaccines. Let's give the authority to those factories to produce vaccines and not just keep it secret in the hands of the big pharma, okay? We are facing a global pandemic. All we ask is the waiver be done, not forever, for a set period, to enable all countries to have access to vaccines. Okay, this is the African Union that's asking for this. What is Ursula von der Leyen answering? Lifting patents is not a quick fix to rapidly develop local production capacity. It could also have significant negative consequences for the financing of innovation. This has always been the excuse for having this intellectual property protection. What is the solution? Voluntary licensing is the best way to ensure the necessary technology transfer. Voluntary means if you want to do it, you do it. You know, when a mother says, please don't drink if you go out this evening. Yeah, it's a recommendation, but that's where it remains. It's a recommendation, okay? Voluntary. If you want to do it, do it. Otherwise, you don't. So here there's already a gap between what she said, we have to make it available everywhere, and now she's saying only voluntary waiver. Why do I put this here? Because it is not just a matter of producing vaccines. It's a matter of how do you get the vaccines to the people? And in order to get the vaccines actually administered, you need to have a healthcare system. It's not that the vaccines, you know, they come down from the sky and they go into your body. You need to have nurses, you need to have doctors, you need to have a place where to go, you need to have fridges where to stock your vaccines, so you need a whole organization. And this is what this is telling you. This figure, it tells you it's not a matter just of development and production, and I want to insist development and production because this is what we're doing now in Africa, development and production, with the Global Gateway. But this tells you that it's not just a matter of development and production, it's also a matter of procurement, how do you buy, how do you stock, but it's also a matter of healthcare delivery. Who's going to do the job? What kind of an organization? Do you have the clinics? Do you have the syringes? Do you have the nurses, the doctors? Okay? You need all of the components. It's not just a matter of producing the vaccines. I get sort of, about this, because look at this figure, this map. People vaccinated against COVID-19 up to 16 March 22. That is the worst period in the pandemic, okay? And what you see on the left, on this left map, you see the percentage of people that actually got shots, that got the vaccine, that were vaccinated. And you see here that that's why I couldn't see very well. You see, you can see here, I couldn't see the figures, that this goes from 10% in certain countries to good, in some cases over 50%, but you see, in so many cases, we're talking about people vaccinated in the range between 10 and 30%, okay? 10 to 30, whereas in Europe, we're talking about 64. But what is even more worrying is the right hand, which is something that we worked out with a student that wrote a thesis on this under my supervision. COVID vaccine supply administered, which means if you have 100 doses in your hands, okay, you're in Chad and you have 100 doses. How many were you able to administer? Less than 30%. Which means that not only a limited amount of vaccines got to Africa, but then that out of that limited amount, in certain cases, only a very small percentage of those vaccines available were actually administered. And I think that this is even more alarming. Why is this the case? Because there are no health systems worth the name, unfortunately. And so what I'm arguing here is that unfortunately the original promises were not really carried out. As of October 2022, just 24% of the continent's population had completed their primary vaccination series, compared with a coverage of 64% at the global level. And now let's hear what Dr. Moeti, that is the World Health Organization Regional Director for Africa, what is he saying? The end of the COVID-19 pandemic is within sight at the time, 22, but as long as Africa lags far behind the rest of the world in reaching widespread protection, there is a dangerous gap which the virus can exploit to come roaring back. The response to multiple public, and this is another problem, public health emergencies is also affecting COVID-19 vaccine rollout. Outbreaks of polio, measles, yellow fever. And let me say that now we've got a measles problem in Texas, which is so I'm talking about the United States. And what is Trump's position? Let's cut all subventions, all support. I don't know if you know it, but this is something that we have to put into the picture because he's decided to freeze all the money of USAID, not only USAID, which has been extremely important in Africa, and the Ebola problem was basically solved by USAID, not by Europe, so by the United States. But He's also cutting funds for the NIH, which is the National Institute for Health. And this means big problems, probably not only in the US, but also in Europe, because a lot of research is carried out in the US, and it's important for the entire world. So we are in trouble when it comes to these topics. And as I said, measles, coming back to Texas and people dying of measles. The EU, now the final note by Concord Aid, Watch 2022, the EU failed on an epic scale to support its partner countries. Okay, so yes?
Sorry, can you maybe shed light on why does this country in Africa have a poor healthcare system? Because it has to do with colonialism and Europe and national leaders, and
Yes.
I think it matters to mention it too.
Yes, actually, you will get some elements in the last part, because to have the full picture, I have no intention of supporting African governments, because African governments are not taking care of the problem, most of African governments. So it's not that I'm saying that the EU is the bad guy and African governments are the good guys. Not at all. I will show you some figures. Not figures, I'll show a figure from, not a figure, a graph from Freedom House, which tells you that unfortunately in Africa, the majority of the countries are not free or partially free. So let's put it this way. Political systems in Africa are largely authoritarian systems. Democracy is something which is elsewhere in the world, which means that if they're not taking care of their own population, they're not taking care adequately. And actually, they had a commitment to spend at least 15% of the budget on health. This is the Abuja commitment, which dates back to 20 years ago. But they're not respecting that. So the point, I think this requires a lot of discussion. The point is, are we interested only in negotiating with the governments that are in place? Are we only interested in doing what they want us to do? Actually, that's not even the case, because the EU is doing basically its own interest when it comes to Africa. But still, what I want to say is that we should also take into the picture the fact that African governments are not doing their job. They're not taking care of their own population. But I'll say more in the last part. But thank you for the question, because it's perfect. It's right that you should ask. Do interrupt me if you want, which means that I have time to drink a drop of water. So I'm coming closer to the current situation, the multi-annual financial framework 21-27 and the 2022 EU-AU summit. So what I'm doing here is I'm comparing the first three goals in the African Union's Agenda 2063, which is supposed to be the orientation document for the African Union, and the first three goals in the document towards a comprehensive strategy with Africa, which was approved in March 2020 and was supposed to be the blueprint for EU's intervention in Africa. Now, if we read, what do we see? A high African Union, the Agenda 2063. What's goal number one? A high standard of living, quality of life, and well-being for all citizens. Priority number two, well-educated citizens and skills revolution underpinned by science, technology, and innovation. Well-educated citizen. So the first one, high standard of living, we can think of food security, for instance. Number two, well-educated citizens, we can think of education. Number three, healthy and well-nourished citizens. So it's health. So it's basically, we can go back to the Millennium Development Goals. You remember 1, 2, 3, 4. This is what they're endorsing. What do we read in the European strategy? A partnership for green transition and energy access is number one. Green transition, which is our problem. Why is it that I say our problem? Because we are the ones that need to change need a green transition, not this, in the case of Africa, the first thing is not the green transition, but it's climate mitigation. It's how do we adapt to the climate changes that are already occurring. Because in Africa, a large percentage of the population doesn't even have electricity. So they're certainly not causing the CO2 problems. Partners, number 2 is partners for digital transformation, which is a big topic in Europe, but you don't find it on the other side in the same terms. Number 3, partners for sustainable growth and jobs, which is tightly linked to the market investments. So my point here is, I'm just looking at what is written in the documents, and it's kind of difficult then to say that we're actually pursuing the partnership approach that is endorsed in the renaming, rebranding of DG DevCo. DG DevCo is the DG that dealt with development cooperation, and its name was turned into DG International Partnerships, which sort of implies that we want to change the discourse, the donor-recipient, donor-beneficiary narrative. We want to be equal partners. Can we be equal partners if we are saying 2 completely different things? They want something, and we are saying something completely different, which reflects our interest, and we're putting the money where our interests are. Level of priority given to each SDG in the European Commission and her representative joint communication, the communication that I mentioned above, towards a comprehensive strategy with Africa. This comes from this book, from this article, and what he did is reading through the document, what is the priority that we can identify with respect to the current SDGs. I told you, the United Nations originally had those Millennium Development Goals, 8 Millennium Development Goals. Now instead we're talking of Sustainable Development Goals, and it's not just 8, now they've become 17. I'm very critical of this, because at this point you can put everything inside. Not only is it 17 goals, but there's 169 different ways in which you can define these 17 goals, okay? So this is practically everything. But nevertheless, what is the level of convergence between the discourse in the comprehensive strategy and the SDGs? As you see here, number 1, of SDG number 1, no poverty, low priority in the comprehensive strategy. Zero hunger, low priority. Good health and well-being, low priority. I'm going through the low. Clean water and sanitation, which is crucial in Africa, low priority. Reduced inequality, low priority. Life below water, which means in sea, problems in the sea, low, and life on land, low. What is high instead? What is high? Look, oh, how strange. Affordable and clean energy, that's high. Decent work and economic growth, so we're talking about the market, high. Industry, innovation and infrastructure, that's again high. High. Peace and justice, strong institutions, high. Partnership to achieve the goals, high. I don't want to go, I don't want to go further into this, but what I'm saying is that there doesn't seem to be a great alignment between the SDGs and the comprehensive strategy with Africa endorsed by the European Union in 2020. Now again, you see I'm sort of fixed with going and looking at the documents that have been agreed by the Commission with each individual country in Africa. And again, at the same exercise as I did for the 10th and the 11th EDF, I'm looking at the national and indicative programs that have been signed by the EU and the individual countries. You see, I've done it for each country, Angola, Benin, Botswana, Burkina Faso. What is it that I'm doing here? I'm looking at whether the priorities in those documents have to do with governance, peace, and migration, with green, digital, and sustainable economy, with green energy and environment, with jobs and growth, or the last, with issues that can fall under the heading human development, health, education, and vocational training. What is WASH? WASH is something important, having lavatories, having clean water in schools, especially, not only. I don't want, obviously, we're not going through the priorities of each individual country, but this is to show you where do I get the figures from, okay? It's a reclassifying. So we just want to look at the total. What does the total tell us? In 43 times out of 48 countries, the priority is governance, peace, and migration. Now, what falls under this? That would require a lot of investigation. But 30 fall under green, digital, and sustainable economy. Digital and sustainable, green energy and environment, 22, jobs and growth, 7. When we come to human development, it's a bit better, but still it's not a priority. It's still the number of the times that we find these topics, these goals as priority. In 24 cases is education and vocational training, but it's 30 times green, digital, and 22 times energy environment. And the story doesn't end here. So again, what I'm saying is that what seems to be the case is that in these documents that the Commission in particular is negotiating with the countries in Africa, when it comes to signing the document, what comes first is usually issues that have to do with interests of the European Union. And we're coming close to what I was saying, that the discrepancy, the gap between discourse and policy practice is closing up, because not even in the documents now do we actually find so many times reference to good health, well-being, poverty eradication. We mostly find reference to investment, innovation, technology, production, global markets, trade integration. So it's an economic perspective. We find it in the documents, we find it in the practical policy implementation. So that title of my presentation today is probably not so correct anymore, because that gap is closing. But from my point of view, this is not good news, and I will try to explain in what sense. But coming even closer to us, midterm review for sub-Saharan Africa, which means that halfway through, the Commission revises these national and indicative programs with each country, okay? With each single country, a revision. A revision for the last years that are still to come, 25, 26, because the multi-annual framework goes up to 27, okay? Too many figures, but I will show you what is it that I want to point out to. Where is it that you have the greatest... Ecco di nuovo perché non vedo. Otherwise the figures are too small. I want to point out this. You see that where I have the arrow, support to investments. Look at the figures. 1,450 million in the was the original amount. Now it is 3,233 million. So in the revision, what has happened in the revision? A lot of money, extra money has been put in this for development cooperation. But in fact, I mean, it's not me, it's them. It's the Commission that is telling me that the money is being used, what for? To support investment. This is not exactly health, education. And in, so this is the point I want to make, that the midterm review, there is an interlinkage. This is very interesting. An interlinkage now between development cooperation and the Global Gateway. What is the Global Gateway? The Global Gateway is the investment package that the EU launched as a reaction to the Belt and Road Initiative of China. So it's an investment package. But what I'm telling you now is that it's extremely interesting how the two, this was supposed to be development cooperation, but actually it's coming so close. There's an interlinkage between development cooperation. So development cooperation first was tuned towards, the money was shifted towards migration issue with the, as you saw, migration with the emergency trust fund. Now we're shifting money towards the investment package. And sometimes you have really funny results out of this. I will show you in what sense. Go immediately to that. The interlinkage between the global gateway and development cooperation funding. I took the example from Tanzania, which is a country that I have often visited 6 times. The project approved under the global gateway refers to, so actually it's interesting because in this case we have investments that are that could be very useful for mitigating climate issues in Africa. We're in the investment package here. Irrigation infrastructure, very useful in order to have sustainable agriculture. Construction, here not hydropower plant. This, okay, we go towards instead EU interests. But EU-India digital corridor, that also goes towards EU interests, connecting Europe with India through Africa, digital. But sustainable coffee production is something that is more in local interest. And river embankments to prevent floods. So we have as many as 3 projects approved in the Global Gateway package that have actually an important impact on living conditions of people in this particular country, Tanzania. But now the funny thing is, according to the midterm review of the multi-annual indicative program, which means if we now turn to development cooperation, look what we read in that document, the midterm review by the Commission. The following paragraph is added to section 1.3 priority areas of EU cooperation with Tanzania under the subsection Green Deals. What does it read? Additionally, in light of the adoption of the EU's Critical Raw Materials Act, the EU and the government of Tanzania are collaborating on the development of supply chains related to identified critical raw materials. To reduce the dependence on single sources of supply for essential minerals for the green and digital transitions, which are in our interest, for Tanzania, this presents an opportunity, so there's you're arguing about it, to establish dependable long-term partnerships with EU stakeholders and to diversify its critical raw material partnerships we want to diversify, while ensuring more predictable revenue streams and advocating for a common model of environmental and social governance. What I was pointing out is the two are now totally interlinked, the development cooperation with the investment package. Let me go back now and tell you a few words on this global gateway, and then I'm about to, well, I still got a few things to say, but this sounds like wishful thinking without enough action. But what's interesting is the next sentence. I will only read this Nigerian policy advisor. I will only read this part that is that I've highlighted. The EU is the one that doesn't listen. Was there consultation with African partners leading up to the global gateway? 0. So the EU is even named its DG as Digital International Partnership, and here what we read is there was 0 consultation. What kind of a partnership is it if there's 0 consultation? Now, what have I done here? I have to double check because I was working on this while I was in the States, and I think I missed a couple of countries, including Egypt, so the picture would be even worse. Don't take this for, it's not final. Once again, I went through, this is very useful. You can find it. You go to the Global Gateway, to the website of the European Union, and look at Global Gateway, and you see for each country, you can open a window and see what are the projects that have been financed in each individual African country, okay? I have done the same exercise and sort of classified under these different groups. Energy and green transition, in 20 cases. Digital connections, 12. Mobility and transport, which means also ports, it means highways, it means bus systems, transport, 12. Mining and rare materials, 4. So all of these types of investments that can involve European companies, total EU priorities, 48. Sustainable agriculture and climate mitigation, such as the one I was mentioning for Tanzania, like, as I said, irrigation, sustainable coffee production, and things of the like, 13 projects. Vaccine, when it comes to health, it is only vaccine production, vaccine and medicine. But I insist that it's not an issue only about producing if you don't have a system in place that can handle what you're producing, okay? But the EU is only investing in production. Or safe birth, yes, because this is on the agenda. Try to reducing maternal mortality. This is there. And sanitation. Vocational training, only 3 cases. So all total human development and climate resilience, I put it under the label climate resilience, 29 projects. But I think that here we would come up to 50 or 52. So don't take this for good because I have to double check okay, so we're final part. I've been very pessimistic so far. What can I say? But that's because we have been working from my point of view, in a direction which is not strategically useful for Europe. This is my message. But we need to have the broad picture in order to decide what should we be doing, how to go ahead. Geopolitical competition, I like this figure very much. What about China? Since I have used most of my time, I don't want to go into this, but definitely China is doing strategic investments in Africa. What I'm putting here, only one thing, a picture. I was there last year. This is in Addis Ababa, the towering Africa CDC headquarters. What is CDC? Is Center for Disease Control. Who has built the Center for Disease Control? Look at the guy. Does he look European? I think he's Chinese. So the Center for Disease Control has been built by China. And obviously this gives a clear message. We are here to help you out. So with COVID, China was very sort of present. And I don't want to go into, but China, it's not everything is shining. There are things that are not good with what China's done in Africa. I can tell you in case. Geopolitical competition, Russia. Russia is a completely different approach. It's a military approach. This is an old map. It's not updated. But basically, whereas China is focused on what? Getting resources from Africa, but also getting resources and even food, because China is doing land grabbing in Africa because it doesn't produce enough food for its population, so it needs land in Africa to produce what it needs to feed its population. But it has also done investments such as the Center for Disease Control. Russia is doing a completely different thing. It is providing arms to Africa, security, and here what I'm mentioning is the military coups that have taken place over the last 2-3 years in the Sahel region, and who has come in power. This is very clear. This is the head of the military junta in Burkina Faso, and he's shaking hands with not Ursula von der Leyen, but Putin, okay? So we have certainly competition right now in Africa. On the one hand, China, on the other hand, Russia, with 2 different strategies and perspectives. I was saying, answering your question before, that we have to take into consideration what kind of governments we have in Africa, and I think this is telling. Freedom in the world. This comes from Freedom in the World. How many countries can we consider free in Africa? How many partially free? How many not free? The majority are either partially free or not free, but you see the color, the purple is actually overwhelming in Africa. So the situation is dramatic in terms of the political systems in Africa. And in fact here, again from Freedom House, a destructive race to the bottom. It's not my title. You have coups and power grabs in Burkina Faso, Chad, Congo, Egypt, Gabon, Libya, Mali, Niger, South Sudan, Sudan. Then you have rigged elections in Burundi, Congo, Djibouti, entrenched authoritarianism in Central African Republic, Equatorial Guinea, Eritrea, Itsawini, Somalia. So what I'm saying here is governments in Africa are leaning away, they're sort of further distancing themselves from what we think of as democratic political systems. And at the same time, we should take into consideration that the BRICS are gaining power. So what are the BRICS? Originally it was Brazil, Russia, India, China, and South Africa. But here I want to insist, it is very important that the BRICS are increasing. The number of countries that are joining, you see, members that joined in January 24, invited to join, and again expressed interest to join. Look at how many countries in Africa expressed interest to join. So Africa is moving away. This is the point. And I think that this is also, if the message is still not clear enough, this is very interesting, how the world voted in the UN resolution about Russia-Ukraine war in terms of the invasion of Ukraine by Russia. What you see, Africa, how did Africa vote? Very few countries voted in favor, condemning the aggression, and looking, it's written here, advancing a comprehensive, just, and lasting peace in Ukraine. Just means that it cannot be only in the terms of Russia, okay? Very few countries in Africa. The majority either abstained, and some simply walked out of the room not to vote. What do I mean by this? That Africa is looking around and saying, depends. I can be working with Russia, I can be working with India, I can be working with, doesn't matter. China, we are looking everywhere. We do not have a preference, a specific preference for Europe, because as you see, who is it that voted in favor? It was largely European countries that wanted a peace that had, let's say, that endorsed a position critical of Russia. So I get to the final note, and this is a report for the European Parliament by the Director General for External Policies. It's an official report, and I fully endorse what it says. The EU strategy's pragmatic shift paradoxically revives an outdated understanding of development, with the main focus on its economic dimension, combined with the implicit assumption of, I do not believe in, spillover and trickle down to the social dimension. The strategy's only references to urban environment are smart urbanization, green cities, which do exist, but they're not the entire Africa, which overlooks the fact that around half of urban Africans still live in slum conditions. The rhetorical shift towards de jure equality with Africa has come at a price. It has shielded from sight diversity within Africa, as if the continent were composed only of middle and higher income countries. The final note, the strategy reads like something for the African governments rather than African people at large. Africa is not just this. This is a picture that I've taken in Sudan a year and a half ago, more or less, March 23. This is also Africa. This is me. But you can do things which can be useful for the people. And here I want to close with emergency. I had the chance to visit the hospital that Emergency has set up in Khartoum. So this is the Salam Center for Cardiac Surgery. I don't know what the situation is right now. I have no idea. But I was really amazed by the incredible beauty, level, technological innovation of this hospital. This is where it is. This is the kind of machines that you can find in the hospital. It employs only 50 internationals, nurses and doctors. 450 people have been trained locally. So this is intensive care, 15 beds. What is it? What is the message that I am sending out? Maybe since we're not in the position of China and Russia that can say, we're not the bad guys that colonized Africa. They always start from that point, you know. But we are the bad guys that originally colonized Africa. So we don't start from a good point in Africa. And the strategy that we have chosen, going back to is a strategy of economic investment. And I do not believe that this economic priority brings about trickle-down effects to the social dimension. Why am I worried about the social dimension? Because in Africa right now, if you're aware of it, there are lots of terrorist movements. We think in Europe that terrorism is over because the Syrian problem was solved. Yes, but the Syrian problem simply moved to Africa. So we now have lots of terrorist groups, especially in the Sahel. And it's not just an issue about having terrorist movements, it's an issue about governments not taking care of people's needs. And at that point, the ground is fertile for thinking, well, the government is not doing our good, our interests, not solving and addressing our needs. Why don't we give a try to these terrorist groups? So sometimes the local population is actually supporting terrorist movements in a number of areas. And let me say that probably we have not been, so which means that it's there that we need to start from. The welfare state in Europe has been extremely important for supporting democracies, for strengthening our democracies. If we were sort of helping out in those areas, health, education, probably that would gradually, it's not, we can't export democracy, that's over. That was old thinking, crazy old thinking. But maybe by helping the conditions of the population, maybe would be doing something interesting, something that might in the future lead towards democratic systems. Yesterday, as I mentioned, and some of you were listening to were at the lecture by Romano Prodi, he suggested that we should have at least 30 universities with 30 European programs between a European university and an African university. I thought that this was also an excellent opportunity. And Stella was telling me, yes, but then they cannot come out. They cannot come here because of the blocks in migration. But my position is that we have to stop the brain drain, which means we don't have to drain away nurses and doctors from African countries, which we've been doing. If you go to England, it doesn't matter where, but even in a lot of places, we have African doctors and nurses across Europe. No, that's not what we're supposed to be doing. We're supposed to, especially considering the health conditions in a number of countries in Africa, that's what we could be doing. And now there's a window of opportunity, also because Trump has been cutting, as I was saying before, funds which are crucial for HIV, for malaria, for tuberculosis. So there is a window of opportunity, but the European Union is not going in that direction. It's completely deaf to these kind of solutions. And this has to do with the priorities that are being pushed forward by national majorities. Increasingly, we see center-right governments which are worried about the invasion, and I told you migration is the big problem, and therefore suggesting policies which are, let's draw back, let's sort of reduce our interest even in Africa, but Africa is right in front of us. So I will end with that positive note that I hope we will be doing something like what Emergency is doing right now. Thank you very much.
Thank you. Thank you, Valeria, for your very complex and stimulating lecture. And we have just a few minutes, but if there are questions, maybe we can open the floor.
Yes.
Yeah, thank you, Professor, for the interesting presentation. I appreciate it. More in particular, I'd like to go deeper in the point number 5 about the Belt and Road Initiative, because I think it's very interesting. Since the project from China is more focused on build infrastructure, but not only in Africa, but in all the areas of the world. So
I got entirely your point, but African elites think of of Western Africa. The elites in Western Africa have always been very tied to the French government, and not surprisingly, now what we see is that the people hate the French government and have thrown out the French people. So what I'm saying is that in many cases, if you're negotiating with the elites, they might have an interest, and so far they did have a lot of economic interest, even with European. I'm thinking in particular when it comes to all of Western Africa with French interests. So there is an issue there about the interests of the elites in government in the French countries. I'm talking now specifically about French countries because this is so visible. Now, for instance, think of, so I'm saying that they've been agreed with the leadership, but very often it's interest for a limited elite that is in government. And the problem that I was showing is that we don't have very few countries. Maybe we can speak of Ghana, maybe we can speak of Senegal, maybe something in South Africa, but otherwise in the majority of African countries, it's a restricted elite which controls the entire economy of the country, not the entire, but which controls and has probably a lot of interest, even with European interests. So it's an economic interests are the ones that are dominating, but this is short-sighted, my position is. And it's so short-sighted that, let me give you an example. We had a conference, it was 2 years ago, and Professor Rognoni participated in the conference, and the opening speech was offered by Emanuela Del Rey, Special Envoy to Sahel, and what she said at the time was that let's say the agreement that the European Union had done with Niger, I'm talking about Niger, was the blueprint for all the agreements to be made across Africa. Little detail, a few months later, there was a military coup in Niger, and they don't want to have anything to do with Europe right now, and they're basically asking for security protection from Russia, from what was originally the Prigozhin group, which is now renamed African Corps. Not that Russia is actually doing a good job, because it is unable to stop the jihadist movement and the various organizations that are there. But what I'm saying is, can you imagine? It's the special envoy that doesn't realize that in Niger, 2 months later, you're going to have a military coup, and he's telling us that this is exactly what we're supposed to be doing. What I'm arguing is that I have a feeling that we haven't been following the right path to resettle or to rebalance our relationship, because our relationship has always been sort of a very paternalistic relationship with African countries. Let me give you another example. It dates to, to the African European Parliamentary Assembly, which takes place regularly, which means that you have a number of MEPs from the European Parliament and parliamentarians from African countries. And so I was at this Parliamentary Assembly in Strasbourg in 2014, and Michel, who at the time was commissioner, is chairing the session, and there is a document that is supposed to condemn Uganda's policies of homophobia. And you know it can be very dangerous. If you're gay in Uganda, you risk your life. Okay, so there was this document that was supposed to condemn Uganda, and Michel took such a position with respect to the audience in terms, we know what the good thing, that's things that should not be done, so a very paternalistic approach. The end result was that all of the assembly, all of the African representatives voted against, because they were not ready to have Michel tell them what they were supposed to be doing. It's our business. So the thing is, the world is going in a direction, and I fully agree with Prodi, in which we have to accept the world is different. Different countries, different political system, different views. We cannot think that we are the ones with the right, especially with what we've done in the past, that we have the good solutions. So it would be sort of less paternalistic if we had a different approach. So but on the other hand, let me say that China is starting to have some problems, and I've seen it myself, because the quality of the investments that have been done is not always high. I remember seeing, and I use this example often, a university that was built in Dodoma by China. I was there in June, and the following year, in June, the buildings were just finished. The next year I go back, and the floor is cracking, which means 1 year later the floor is cracking. What kind of materials did you use? One. Two, there are a lot of, the way in which the workers are treated by Chinese firms is being very, let's say, criticized, increasingly criticized, and very often they don't even bring more work to local population because they bring over a lot of workers from China. So there are elements of China's intervention, apart from the, you rightly mentioned, the debt question. You can't get out of it. You risk losing the investment, even the airport, if you don't give the money back to China. So there are issues, a lot of issues that might open up a window of opportunity for Europe to act in a different way. But this is not what we see with a global gateway. At least this is what my position. Yes. Yes.
So first of all, thank you for the presentation. It was very interesting and enlightening. I was wondering about your opinion on, or maybe I should start in another way. When I talked to German parliaments about new partnerships with the African Union, for example, they always said that there's a high corruption in these countries.
Absolutely.
And that's why they don't want to support and don't want to invest a lot in development, to which I replied, honestly, that I see a lot of chances in multilateral organizations, for example.
No.
Multilateral.
No.
And that's why I wanted to ask for your opinion on that. And yeah.
I fully agree on what you said about corruption. And that's why I totally against budget support, because you're giving money to the government and you don't know where the money will end up. So totally against. I had a fight with Michel on this, exactly on this point, because he's the one that originally proposed budget support. So I'm totally against budget support precisely for the reason that governments are extremely and highly corrupted in Africa. But my position is you should promote projects that you can really see the outcome on the ground. So I'm talking about primary health care. I'm talking about a school. I'm talking about something extremely visible, because we need to have visibility. I think because, yes.
The last one?
I have one question about the fact that Europe wants to keep some countries authoritarian for their economic interests. And I'll take the example of France that is actively supporting totalitarian regimes. And private French firms such as Bolloré tend to support those countries in order to extract as much natural resources as they can. And I was just wondering if Europe has the same kind of lead. It has to do with corruption too.
No, it's a bit, I wouldn't say France was trying to do that, because, for instance, uranium is a resource extremely important for France that has nuclear plants, so they needed the uranium coming from Africa, in French-speaking Africa. But they're not in such a position now. They've been thrown out everywhere. Okay, so there is an issue there in terms of the European Union. We haven't gone into that, but the European Union has lots of strings when it gives money, lots of strings, conditionalities, for instance, respect of human rights and all that. And if you go and look at that, you would be able to find that in some cases, this has been actually taken into consideration and aid has been suspended because of human rights violations. In other cases, no, because it was important to keep a relationship. My position on this is very pragmatic. Since, as I said, most of Africa is out of the field of democracy, we have to talk to them in any case. So the best is that what I'm suggesting is let's not make it a big issue about what kind of a regime there is there, but let's try to do something to support improvement of living conditions of the people, because this, and in particular education, is crucial, because this might in the future help the development of democracies, democratic, but not because they have to copy us. It's their way, it's their way they have to find their own way. But since we're going to be interacting, because Africa is in front of us, we cannot avoid it, my position is, why don't we think about something different with respect to investments and what we're doing that definitely do not benefit and probably are simply benefiting very small minorities.